Good day, I am Pat Dante from the SN12K, and for today, I'm going to perform Leopold's maneuver return demonstration. Leopold's maneuver is used to systematically palpate the gravid uterus. It is an easy-to-perform, non-invasive method to determine the position, presentation, and engagement of the fetus inside the uterus. Leopold's maneuver is after 36 weeks gestation to help the mother and the healthcare provider be better prepared for the labor and also helps in determining if it's much safer to perform cesarean section. So prior to the conduct of the procedure, I have already prepared necessary equipments needed, which includes a pillow, a towel, and a stethoscope. This is to avoid going back and forth and also to save time and effort. Next, I have already performed hand washing, so now I'm just going to do a hand hygiene to deter the spread of microorganisms. Okay, next is we have to meet the client, greet the client politely, and explain the procedure to the patient to gain patient's cooperation and reduce anxiety. Good morning, ma'am. I am Pat Dante. I am your student nurse for your day. So, can I see your wristband, ma'am? Please state your complete name and your birth date, please. Okay, thank you, ma'am. So for today, ma'am, I'll be doing a Leopold's maneuver. It is an easy method, ma'am, which we use to determine the position of your baby inside your uterus. Okay, so later what I'm going to do is to feel your abdomen and add a little pressure so that I can feel and determine the position of your baby. So will that be alright, ma'am? Okay, it will be fine if I close the doors and draw the curtains so that no one from the outside will be able to disturb you, ma'am. And also for your privacy. Okay? Thank you. Okay, so next is we are going to let the patient empty her bladder before the procedure. A distended bladder may slightly deviate the uterus. Okay, ma'am, so before we begin, I need you to void first so that later you wouldn't feel uncomfortable. Thank you, ma'am. So, we're going to position the patient supine with one pillow underneath her head and flex knee and place a rolled towel underneath the patient's right hip to prevent supine hypotensive syndrome. Okay, ma'am, so you're back, you're done voiding, alright? I need you to lie down, ma'am, and slightly flex your knee. Okay, I'm going to assist you. I'm going to place a pillow. Okay, so ma'am, can you, I need you to turn your side a little bit because I'm going to place a towel underneath your hip. Okay, I'm going to assist you. Okay, so if right-handed, stand at the woman's right facing the patient to easily grasp the symphysis pubis to be done in a third maneuver. Okay, so now, ma'am, we are going to begin with assessment. So I'll be needing to expose your abdomen. Is it okay with you, ma'am? Okay. Okay. So now I'm going to proceed with the first maneuver, which called the fundal grip. We need to stand at the foot of the client, facing the patient, and place both hands flat on the abdomen. This maneuver determines whether fetal head or breech is in the fundus. Okay. Proper positioning of hands ensures accurate findings. Okay, so now I'm going to proceed with the second maneuver, which is the umbilical grip. We need to face the client and place the palms of each hand in either side of the abdomen. This maneuver locates the back of the fetus. We're going to palpate the sides of the uterus. So, we're going to hold the left hand stationary on the left side. Okay, so now with the right hand, we need to palpate the opposite side of the uterus from top to bottom. Okay, then now we're going to hold the right hand steady and repeat the palpation using the left hand on the left side. We need to locate for the fetal back to know the heartbeat of the fetus. Okay, now proceeding to the third maneuver, which is the pollex grip. We need to gently grasp the lower portion of the thumb and index finger and try to press the thumb and finger together. We need to determine movement and whether the part is firm or soft. And also we need to determine whether the fetal head is descended to the pelvis of the mother and engaged in the cervix. And if it is movable, it is not engaged. And if it is not movable, then it is engaged. Now, I'm going to proceed with the fourth maneuver, which is called the pelvic grip. We need to face the foot part of the client and place fingers on both sides of the uterus at approximately 2 inches above the inguinal ligaments, and pressing downwards and inward in the direction of the birth canal. Allow fingers to be carried downward, and we need to determine the flexion of the head. Okay, so now that we're done with the maneuvers, we are now going to locate the fetal back again and listen for the fetal heart tone for at least 1 minute. We're going to note the location, the rate, and character of the fetal heart tone. Okay, ma'am, so now we are done with the palpation of your abdomen. I'm now going to listen for your baby's heartbeat. Okay, so in cephalic presentation, FHT can be heard in either left or right abdomen. If breached, FHT can be heard above the level of umbilicus, either left or right. Okay, so now we're going to make the patient comfortable to ease and to promote relaxation. Okay, ma'am, so now we are done with the procedure. I am going to cover you up now. Alright, so are you comfortable, ma'am? Okay, so after doing the procedure, ma'am, I have determined that your baby is at your right side and your baby is in cephalic position, which means the head of the baby is at the lower part of your uterus and it is already engaged. And this is an ideal position of the baby for labor. Also, when I was listening for your baby's heartbeat sounds, I have counted and it is in 125 beats per minute, and that is normal. Okay, ma'am, so do you have any other questions or clarifications? Okay, thank you. So now, after doing the procedure, proceed to performing hand washing and documentation of the findings. So that's it for my Leopold's maneuver return demonstration. Thank you and God bless.